So you can use our Helios 980. You can use it every day. I have people that that bought it, they use it, and they'll say, yeah, just whatever aches that day, I use when I'm having my coffee. And so that it could be used like that. Or people will use it to solve a particular problem, and it may take 2 to 3 weeks, but they get results. I just got a great text yesterday from somebody that said they've used it every day now for 2 weeks, and their problem is gone, and they're just extraordinarily happy. So
that's amazing.
Yes,
so
it's good.
Yeah, I mean, could this be just from, I know we're talking really general in terms of chronic pain, like arthritis and that kind of thing, folks with Lyme disease, anything that like aches and pains?
Aches, pains, inflammation, the home device helps just like the laser. Just takes more treatments and longer treatment times, but you're in your home, so you're not really under schedule. You can do it when you're having your coffee. You can do it when you're watching the TV or watching the news.
So I wonder if would the treatment regimen involve like, a clinician recommending a home device and, concomitant therapy in the facility as well? Like, would they do both potentially?
Yes, and that's quite common actually. Quite a few of the people that use our laser can sell the home device to their patients as well. And the patient can take it home and use it in between. Patients can't always get in on the right schedule for the treatments, so they have something they can use at home. And, but a lot of times if they're coming in with chronic sciatica, you want to give them the boost of doing a few laser treatments first. Then when they're to a certain level, you can give them the home device if they now continue to use this.
Right. Okay. And so do you have like a general price point for the home device? I know we talked about, the facility one, but...
The home device sells for $599.
Very reasonable. Yeah. Okay. I just love that you're offering, anything non-invasive that we can do to help these folks. Obviously you're treating various patient types, but especially if they've undergone a very invasive surgery, for example, having a way to expedite that healing is just extremely valuable. So I love it.
Yeah, great. Yep.
Well, I think we could probably talk all day about patient types and what makes your lasers so amazing. But what I'd like to do is just kind of wrap up our podcast with a little bit of info for the folks that may be listening that maybe have some interest, and I'll post some information below that maybe want to get in touch with you directly or with the company. I don't know if it would be you yourself, but in terms of, hey, I have a facility that I think could really benefit from this. What's the best way to reach out to you for that?
They can certainly call. They can call me if they want it. My number is 440-785-2298.
Okay.
440-785-2298. Our headquarters is in Cleveland, Ohio. They can send me an email at jim.oneck, OHNECK, at Epoch, EPOCH, lasers, LASERS.com. Or they can go on our website, www.epochlasers.com, and they can send an email through that website if they want. And also, there's lots of product information and technical information and scientific information on the website as well.
Very good. Okay, amazing. Well, like I said, this kind of thing is really exciting, and just hearing about alternative therapies that are out there and getting your information and your solution in front of the right folks. I think it's, like you said, you're a small team. So if anybody listening and tuning in has some opportunity there, I think it makes a lot of sense. Our business and Intellilogic, we're based out of Ohio, so we certainly have some presence here with some of our listeners, but you would be able to help. I know you mentioned even outside the country, but anything in the States as well, correct?
Absolutely, yes.
Okay.
Yeah, we have a small team, but we hopefully can expand that team, maybe through distributors. But we provide the training that comes with the machine. We don't charge extra for the training.
Yeah.
The better people are trained, the more successful the outcomes will be.
Absolutely, yeah, and that's a win-win. So, okay, amazing. Well, Jim, I've enjoyed our conversation. Like I said, folks, there's a lot more information on Jim and his lasers. We just can't fit it all into a 30-minute podcast, but we will certainly put some links below the recording, and reach out to Jim if you have any interest or questions further. So I really appreciate it, Jim. Thank you so much.
Yes, thank you very much as well.
Bye-bye, guys. Okay, so we're good. And I'll edit all of that. And what I'll do, like the beginning, I didn't make it real formal, if you noticed, like, because what I'll do is it'll just be kind of like a fly-in video with your name and, first and last name, company, all that good stuff. So we'll brand it and make it look really nice, and then I'll get it to you.
Great. And so are we allowed to use it and put it out on our social media channels as well?
Absolutely. Yeah.
Okay, great.
Yeah, that would be great. And then sometimes it takes a few days for me to get these edited, but as soon as it's completely edited, I'll get it to you. What I like to do, and what I also recommend for folks like yourself, is instead of publishing the entire podcast, is like the little snippets of it is really what, it's hard to get people's attention for 20, 30 minutes. So I will also send you like some clips of it that might make sense for your social or website too.
Yeah, that's good. Then we can do little reels and things like that. So.
Yeah, exactly. So, well, I think this was a good conversation, and I think just enough for them to maybe spark some interest in what you're doing specifically for some non-invasive, help, because this is something that even in the foot and ankle space, my husband, like, this is something that, he goes into the journal clubs with the physicians, and they're just patient outcome, and, readmittance into the hospital, and anything they can do to help with that is always going to be of interest. So,
yeah, treating the foot neuropathies, or people that have had surgery on their feet because they've, dropped stuff on their feet and broken all the little bones. There's a lot of bones in the foot. And so people that get swelling in their feet and their ankles, laser can be used with all of that.
Yeah. Yeah, no, I love that. And one thing that I kind of actually forgot to touch on, but we discussed, was like the oncology piece as well, right? So with the chronic pain that just comes.
Yeah, it's probably okay we didn't go down that path.
Yeah, I know. You don't want to make any claims that,
right.
I get it. We talked about that. You don't want any accidental things to happen to you, right?
Right, exactly.
We shrink and eliminate cancer tumors.
Yeah.
I love it.
Yeah.
Amazing. Well, thanks for your time, Jim. I know that you're wearing a lot of hats and you're very busy. So thanks for hopping on. I think, hopefully there's some ROI for you in the time that you spent chatting with me.
Great. Well, I appreciate the opportunity. Hopefully it was okay and it made sense and my answers made sense. So it seems
I think so. I've realized that I was overthinking a lot when it comes to the podcast, and we just sit down and talk, right? And then I can put some bells and whistles on it and make it look even better. But at the end of the day, it's what we're saying and just getting the info out there. So
yeah. Great.
Okay. Well, thanks, Jim. Have a good rest of your day.
All right. Have a great weekend.
Thanks. You too.
Yeah.
Bye-bye.
Bye-bye.